Namaskar, I'm Dr. Shweta Bansal. I'm a pediatric oncologist. Today we are going to have an information about neuroblastoma. Neuroblastoma is a disease which actually happens in the sympathetic ganglia or parasympathetic ganglia of the body and adrenal gland. So these are the organs which get affected, and the presenting symptoms of the child are mostly they are having a lump in the abdomen. Sometimes they have a hypertension, sometimes they pass red color urine, and if they are at advanced stages they have a bone marrow failure because of the infiltration of the metastatic cells in the bone marrow, and their blood cells stops getting formed, and they have anemia, they have thrombocytopenia, blue spots in the body, and sometimes the cells come into the bones also and the lumps start getting formed in the body. So there are different stages of neuroblastoma with which the child can present. Now stage 1, stage 2 and stage 3 neuroblastoma are highly curable. We are not worried about it. Mostly they require surgery or just some chemotherapy, and they have a very good survival, almost 80 to 90% or even 100% in many of the cases. But when it comes to stage 4 neuroblastoma, it is a difficult disease to treat. And many parents who are battling with this neuroblastoma, they know how difficult it is. There is a very high risk of chance of relapse, and the survival is only 0 to 40%, even with the best of the therapies. And most of the stage 4 neuroblastoma patients, they require chemotherapy, they require surgery, they require bone marrow transplant, they require radiation. And even after doing all this kind of a treatment, the chances are that there will be a relapse. And nowadays there is a immunotherapy, which is anti-GD2 therapy is available. There are multiple types of anti-GD2 therapy is available. One is this dinutuximab, another is nexituximab. So on these basis, sometimes one of this immunotherapy is now available in India, and it is easily can be given to the child. Initially we give it in the ICU setup, but if the child tolerates very well, it can be given in the ward. So we have a very good experience in giving immunotherapy to these children, and we have seen a very good response. Now the question is, does immunotherapy really helps? Yes, immunotherapy really helps because it improves the survival from 40 to 60 to 70%, and the chances that the relapse will happen to the child decreases a lot. So with this information, I would say if there is any further queries, you can write to me on this email ID, and I will be more than happy to help you. Thank you very much.